A little bit about myself. When I was in the legislature, I passed a bill dealing with income taxes. It's known as the largest permanent income tax reduction in Ohio's history. And it's scheduled to take effect, ironically enough, in July of this year. So we're going to have a real partner. What it does is it brackets the income tax tables for inflation. What that means is that if you get a cost of living increase, the income tax brackets go up at the same speed as your income goes up, so it doesn't bump you into a higher tax bracket. Over time, it'll save Ohioans billions of dollars. So that goes into effect in July. Let's turn our attention to Washington, D.C. for just a minute. I wanted to talk some about the health care bill. I'm hesitant to call it the new regulation coming out of Washington. You know, it's interesting, D.C. had their own deficit, huge deficit. And you'd think the way they'd want to deal with that would be to somehow cut spending, cut programs, do something reasonable that actually impacts the deficit. Well, they did impact the deficit, but in the opposite way that you would think. Instead, they spent money at unheard of record levels, highest in history, in fact, and they implemented the largest new entitlement in history. So they spent more money and they implemented the largest entitlement, not just in the history of this country, but I think in the history of the world. This thing is a monstrosity. Now, I'll be honest with you, I haven't read all 6,000 pages.
Neither have they.
I want to make one point and then give you a 20,000-foot overview. This will be the first time in the history of this country that the federal government actually controls, it actually controls the healthcare outcomes of Ohio, of not just Ohioans, but anyone in this country. And not just those, and a lot of people aren't aware of this, I just became aware of this, not just those that are signed up in the public option, if you will, but even those of us that have private health insurance. Before we can be treated by our doctors under the terms of this bill, the doctor has to send his strategy for treating you to Washington bureaucrats. It's in the bill. And they have to approve or disapprove that before you can be treated. So in essence, your doctor will no longer be the one determining what your health care is going to be, what your treatment strategy is going to be. It'll be determined in Washington. And that's extremely scary, because this is the same government that enforces Roe versus Wade. Intrinsic in that government is not a tremendous respect for life. It's very disconcerting. And all this talk about not a tax increase, that is scary. I mean, just consider, we're talking about the largest bureaucracy in the history of man. We're talking about health care for anyone who wants it. We're talking about a myriad, 16,500 new IRS agents. And yet, President Obama has the nerve to look at us and say, but there'll be no tax increase. In fact, it'll reduce costs. You know, this president is amazing. I mean, he should be selling swampland in Florida. I mean, it's fantastic, his sales ability. It seems as if the media and huge numbers of the American people are buying that. And yet, just on the face of it, it's clear it's impossible.